Okay, we're now live on YouTube as well. And we'll welcome our participants as they're tuning in now and logging in. We'll get started on the hour, half hour in Newfoundland, and the opportunity to ask questions of the panelists. Please let us know that you're here, where you're here from, and if you have any questions that come up during the webinar, please write them in the chat function in the toolbar at the bottom of your screen. But once again, Bill, this will be recorded and shared with everyone who's registered, as well as being available on our C.A.R.P.ca website soon after the event. And we're just waiting for our participants, our participants to come in and join us on the hour. And if you do have a question of the panelists during the conversation, please do write it down in the chat function at the bottom of your screen. And if you're just logging in now, give the chat a try. Let us know that you're here and where you're coming in from. Thanks. Bill, I'll turn off my video and I will share my screen and get the beginning of that up to date.
Good.
And you can watch your clock and get started whenever you're ready.
1 minute.
1 minute, perfect.
This is where we need a C.A.R.P theme song, so we have some background music while we're waiting for these events to begin. Maybe we should put out a call to some of our C.A.R.P members who are composers to see what they could come up with for us. All right, well, I think we're ready to get underway then. Good day to everyone joining us from across Canada and elsewhere. Welcome to this C.A.R.P webinar on something that really affects all of us, how cancer gets treated in Canada. We're calling this session the Cancer System Recovery Project, what needs to happen to address pandemic backlogs and ensure quality cancer care is available for Canada's seniors. Next slide. My name's Bill VanGorder, and I'm the Chief Operating Officer and Policy Officer of C.A.R.P, and I'll be your moderator for what promises to be a very interesting session with expert speakers who I will introduce shortly. Next slide. At the end of the discussion, we'll have some time to answer questions you might have. So please feel free to submit them whenever you can by using the chat panel. You can do this by clicking the chat button and writing your question. The chat is being moderated by C.A.R.P's Anthony Quinn, who will bring the questions forward to me. If you want any questions to be directed to a particular speaker, please say so. Next slide. So let's get started. We're holding this discussion because Canada has a very big cancer problem. Our cancer system is already strained. It was strained before the pandemic, which is what a survey after survey has told us and our leaders. And then COVID struck. And we're likely to have experience of how the pandemic has impacted access to medical consultations, tests, care, and treatment. And cancer is no exception. Indeed, the consequences have been very serious. Next slide. C.A.R.P wanted to find out exactly what the impact had been and what should be done about it. So we asked our members. We conducted a survey earlier this fall to find out how the pandemic has impacted cancer care, for themselves or the people they care about. We also asked what they thought of a few things that could be done to help solve the problem. And I want to share some of those results with you. We had over 2,000 respondents, so this is a very good sample of the feelings across the country. Next slide. Here are two of the key findings. Almost 1 in 3 people who received a cancer diagnosis since the pandemic began in March 2020 said their diagnosis was delayed because of the pandemic. 1 in 3. And 1 in every 4, 25% in our survey, said the cancer surgery treatment had been delayed as a result of the pandemic. Next slide, please. You don't need to be a cancer expert to know that when it comes to cancer, delays are not good and can have serious consequences. Of the 440 survey respondents who said their cancer care had been delayed, 60% said they're concerned that the delays will have a negative effect on their cancer care. And not surprisingly, but very importantly, half of these people said the impact on their cancer care delays hurt their mental health, and that was a moderate, major, or severe impact. Next slide. Respondents identified 5 key problem areas in Canada's cancer care system. 1, it takes too long to get an appointment or a test or a procedure for cancer care. Almost 50% said that. There are not enough services available outside of the large cities. It takes too long to start treatments from the time of diagnosis. We don't have access in Canada to all the newest cancer treatments. And finally, it takes too long to get a diagnosis with cancer. Next slide, please. Our C.A.R.P survey is not alone. Similar findings have shown the impact that's been found in surveys by the Canadian Cancer Survey Network, and various cancer experts have also voiced their concerns over the disruptions in cancer care caused by the pandemic. Next slide, please. With all this, we know we have big issues on our hands. What can we do about it? We're all familiar with the old saying about when we're handed lemons, let's make lemonade. Well, that's an attitude reflected in this great quote from Dr. Gerald Baptiste, the medical director of the Segal Cancer Center of the Jewish General Hospital in Montreal. He said, let's take this problem and our learnings from the pandemic and turn it into an opportunity to build a much better system of cancer care across Canada. Next slide, please. So how can we do that? Well, our survey respondents were in high agreement about several suggested fixes, including the following. 88% agreed that provincial governments need to invest more in cancer care and increase services over the pre-pandemic levels to help eliminate the backlogs as soon as possible. 86% agreed that government should do more preventive measures against cancer, including more education on risk factors, public health initiatives, and cancer vaccines. And 76% think the federal government should increase its share of the financing of provincial healthcare costs to help with the backlogs of care and increased health needs due to the aging of the population. Next slide. Well, that's my brief report on our survey, and that shows why we need the Cancer Care Recovery Project. So let's move on to our discussion with our 2 experts. Our 2 guests will discuss the 3 themes. 1, the impact of COVID-19 on cancer care and patients. 2, what can we learn from this experience? And 3, what are the solutions to improve cancer care? Next slide, please. We have 2 expert guests with us today, and we really appreciate them taking the time to share their knowledge and experience. Representing the medical community is Dr. David Stewart, medical oncologist at the Ottawa Hospital and the University of Ottawa. Dr. Stewart's primary clinical focus is therapy for advanced lung cancer. He also brings additional perspectives from his prolific career as a cancer specialist in both Canada and the United States. And to give the patient perspective, we're pleased to have Louise Binder, a lawyer, a longtime patient advocate who is now a health policy consultant with the Save Your Skin Foundation. She co-founded the Canadian Treatment Action Council, the CTAC, in 1996, which advocated for better access to HIV treatments and quality care. Well, thanks to both of you for joining us today. We really appreciate it, and we need to get on with our discussion. So, to begin with, the first theme, the impact of COVID-19 on cancer care and their patients. So maybe begin with you, Dr. Stewart. Can you elaborate on how COVID-19 has impacted cancer screening, diagnosis, and treatment in Canada, and what have you seen in your practice?
Yeah, so the data are very clear that screening went down quite substantially because of both programs being shut down or people being concerned about going to them. So screening was really cut back and is starting to recover a bit, but we're not nearly to the point that we need to be for screening. Also for routine diagnosis, people putting off seeking medical help because again, we're afraid to go out in the public where they might be exposed to things. So my own personal perspective is that the lung cancer patients that we saw over the course of the pandemic have been much sicker when they first show up than before because it has taken longer for them to seek help and then for the tests to be done that are required. Then once they get to us, to get tests done like PET scans or molecular testing, it's always taken too long. It just takes longer. It took longer for part of the pandemic, although everybody's doing their best to try to move things through as fast as they could. But if any facility or lab or anything like that had one or two staff off with COVID, then we had a big problem because then everything got slowed down because of that. Early in the course of it as well, the operating rooms were shut down for all non-emergency surgery because the PPE, the personal protective equipment, was needed for people on the front line treating COVID patients, and there was just not nearly enough PPE around. And also the nurses that were in the operating room had to be used in the instead to help with COVID patients, and so a lot of things like that. And also was concerned that if a patient had surgery that could have been avoided and they needed an intensive care bed, unit bed, that would not be available because of the fact that there are COVID patients in it, or that COVID patients might need it. So surgery got slowed down in a major fashion, just like diagnosis did. From a medical oncology or chemotherapy perspective, we came up with contingency plans. I saw that if a bunch of our nurses who were giving chemotherapy or pharmacists were off with COVID, what would we do? How would we prioritize patients? So the people covering intensive care units have talked about triaging patients. We also had to do that. We had to be prepared for triaging patients, saying who would get treatment and who would not get. And we were very fortunate that we did not have to shut down at all. But it could have happened very, very, very easily that things could have crashed to a halt from the point of view of being able to deliver treatment. In the recovery now, in the surgical recovery, at this point in time, there's still not nearly as many patients as there should be waiting to have surgery because of the ongoing delays in diagnosis or the past delays. And of those that are waiting for it, it's still taking too long for it to get done, longer than it was prior to the pandemic.
Okay, so Louise, your organization, the Save Your Skin Foundation, has seen firsthand the impact of COVID on patients. What can you tell us about the challenges cancer patients have faced during the pandemic?
Yes, so thank you, first of all, to C.A.R.P for inviting me to join my esteemed colleague, Dr. Stewart, on this panel. The first challenge that we saw immediately at the beginning of the pandemic was real fear about lack of information about COVID, about the implications of COVID and cancer. Were people at higher risk of getting COVID because they had cancer? Would they get sicker if they got the virus? How should they protect themselves? Was there a good source of information? for them? Did the virus affect older adults and especially older adults with cancer more than younger cohorts? So general information was the first thing we noticed. The second thing we noticed was a great concern about some of the things that Dr. Stewart has mentioned, including access to healthcare. So suddenly patients realized that many surgeries, screening, diagnostic tests, treatments, care appointments were being canceled or delayed, often indefinitely, with no information about when they may become available. So this meant that the chances for a successful recovery or remission were greatly reduced. As we know, with 1 of 2 people having cancer and 1 of 4 people dying of cancer, this is a huge problem for which pandemic, quote, planning had definitely not accounted. And we all know that cancer is a disease of older adults disproportionately, with 9 out of 10 cancers being diagnosed in people 50 years of age or older. Most doctors were not in their office. Emergency rooms were jammed. Many people were afraid to go to emergency rooms because of COVID. And even if they could get an appointment, many did not have a safe means of transportation to get there, nor could they afford transportation. One study has shown us that the impact of lack of treatment, for each month of lack of treatment, mortality risk increases from 6 to 13%. So imagine how concerning that was for people. They also, of course, feared for their families and their children and their grandchildren. Was their pregnant granddaughter at more risk of COVID than she would have been if she weren't? Nothing but unanswered questions. This, of course, impacted cancer patients' mental health. So we saw that 74% of cancer patients have shown in a survey that this COVID pandemic has impacted their mental and emotional well-being. Adding to that is isolation. They want to see their families, they want to see their children, and yet they're afraid to. And they need to do things, but they're afraid to go out to do them. So we really had a terrible, really an explosion of mental health issues, and getting mental health assistance, particularly if you hadn't been in that system prior to the pandemic, was almost impossible, even if you could afford it. And of course, then we also saw that people were having a lot of problems managing virtual care. Even though it's a wonderful addition in the right places, there were many people who either didn't have the technology, didn't have the technological skills, didn't know how to prepare properly for a virtual care visit. How do you do that? And so all of that. And then, of course, vaccines, when they came along, would we get them? Should cancer patients and other immunocompromised people get them first? And as we progressed, NACI kept changing its recommendations, of course, because it was learning new things. But this, of course, became a big problem for cancer patients as well. So there was so much that just kind of imploded or exploded. I'm not sure which way best to put it.
Yeah, thank you, Louise. Dr. Stewart, coming back to something that you mentioned previously, but could you elaborate a bit? Do you think the healthcare system is ready to take care of the expected surge now of cancer patients?
The healthcare system was not ready long before COVID, and it's no more ready now than it was then. This is a huge problem. I mean, if you look at data from the Organization of Economic Cooperation and Development, or OECD, Canada is near the bottom of the 38 countries with respect to access to CAT scanners, PET scanners, MRI scanners, hospital beds, radiotherapy machines. No matter what you want, we're near the bottom. we're 20th out of 20 of those surveyed in access to specialists. And also then if a specialist that finally sees somebody, it takes them much longer to then initiate the proper testing and therapy than in other countries. So we were not ready before. We are certainly not ready now. And so I agree with Dr. Battis that this is an opportunity to look at everything to try to figure out how to make it work better. And we do need a major investment. And all those things that have been neglected for so long in this country that we've taken for granted that we're good at, but we're just not. The data are clear that we weren't doing well before. We're not doing well now, and we need to change the approach that we're taking. The one thing that has been good all along is Cancer Care Ontario did a good job of trying to make sure that cancer patients were seen by oncologists within 2 weeks of the appointment coming in, so that the wait time to see an oncologist is shorter than for any other non-emergency specialist in the country. But even that, it could be faster. But then if we can't get access to scans and molecular testing and things like that, then those are delays that result in suffering that does not need to happen, and lives that do not need to be lost, and in a lot of mental anguish as well.
So thank you, Doctor. Louise, Doctor mentioned that Ontario had not done a bad job in terms of moving up cancer appointments, but what about the impact across the country? Many people watching today from all across the country. Has there been a difference province to province and region to region? And what can you tell us about that?
Yes, there really hasn't been much specific data that I could find province to province. But I think it is undeniable that people with less access to social determinants of health, including older adults living on fixed incomes, were more adversely impacted wherever they lived in this pandemic than other people were. We do know that as of 2021, cancer death rates are the highest in Nunavut and the Atlantic provinces, generally decreasing westwards. And I'm sure that when the statistics are known, that COVID will have exacerbated that problem. So the bottom line, according to the International Society of Geriatric Oncology, is that older adults with cancer are among the highest risk groups for suffering from COVID-19. And they are at increased risk of being infected and dying from COVID, and that the highest risk of being excluded from intensive care support for COVID-19 infection and or adequate cancer treatment if resources are limited.
Okay, thank you. Dr. Stewart, what measures were put in place by the hospitals in Ottawa, as you saw at the beginning, to try to mitigate the impact of COVID on cancer patients?
So that very importantly, just masking, so that before it became popular anywhere else, we were making sure that anybody came in through the front door of the hospital had a mask on, and limiting visitors, which was a double-edged sword that helped reduce the amount of COVID. But again, it was heartbreaking. Some of the patients on the inpatient service that had advanced incurable cancers, but family members could not come to see them. But just to mitigate that, and also coming up with the priority plans about what we would do if we faced a major problem that we could not deliver care to everybody. Who are the highest risk people? Who were the people that we really had to get the treatments to? But as I said, fortunately, we did not have to explore that because we were lucky and did not have a major outbreak among the staff in the cancer center.
Good. Louise, what measures, I know your organization has taken some measures to support patients during this time. Can you tell us a little bit about what you and your group have done?
Yes, I'd be pleased to. And we didn't do it alone. There was a group we brought together, a group of more than 14 national patient groups, generally in oncology, but some other areas. We banded together and we raised funds to start an online oncology patient hub. And it had three components. The first was linking people to basic information about COVID and cancer, about government, both federally and provincially and territorially, programs that were available, and any other valuable general information. And we kept it updated as new information became available. It also contained links to mental health resources of all kinds. And we even were able to join with a healthcare professional in Nova Scotia to put on an 8-week online mindfulness workshop. I'm happy to report that that continues to this day, this mental health hub. We also raised funds to provide taxi service and coordination of taxi rides to and from healthcare appointments in the Greater Toronto area and in Montreal for over 15 months. Sadly, we ran out of funds to continue this program, which is still badly needed. But we did provide over 2,000 rides in all. And I really need to say a special thank you to our intrepid taxi coordinator, Chantel Burrows, for managing this service. It was a no small feat. We also advocated with all levels in government to ensure optimal rollout of vaccines for cancer patients, including taking out a full-page ad in the Globe and Mail addressed to all of the governments, not to mention sending numerous letters and holding numerous meetings with decision makers. And of course, we worked with our medical colleagues, including Dr. Stewart, to ensure that we were getting and giving the best advice available based on the most recent and up-to-date evidence. So in addition to that, of course, each organization worked with its individual members in the area that they were working, providing one-on-one support and working with their social workers and other supporters as requested. And a huge, huge cheer to all the healthcare providers who've been so wonderful throughout this pandemic.
I'm sure everybody watching will agree with that. Dr. Stewart, you talked about some of the learnings from COVID. What can be implemented to improve the system now? What can be done, almost immediately to make sure that we improve the current situation?
One of the learnings from COVID is that telephone visits and virtual visits are far better than we ever thought was going to be possible, and in fact, they improved efficiency quite a bit. So that was one positive that came out of it. Just watching what happened in COVID, though, as Dr. Battist alluded to, we saw how fast governments could move if they needed to. So that from the virus first becoming known until a vaccine was ready was a year. That in oncology, it's an average of 12 years from drug discovery until it's approved. That's far too long. There are far too many people that die. So that John Peter Bradford, who founded the Life-Saving Therapies Network, and I are working closely together to try to do something about that. But it takes far too long to get cancer drugs to patients. And so what this has demonstrated is that all that they say about how important it is to take time, it doesn't. Taking time costs lives, causes suffering. It just takes way too long to get effective new cancer drugs approved. And then once they're approved, then it takes far too long to get them funded in Canada. So after Health Canada approves it, it's at least another year before the provinces begin to fund it. And that translates into thousands of life years lost and a lot of suffering that should not be happening because there's just too many delays in access to those drugs.
So just building on to that, so are COVID vaccines, vaccines like the COVID vaccine, are they going to be available for cancer treatment also?
So vaccines and cancer, we know that, for example, human papillomavirus vaccine can help reduce cervical cancer. Hepatitis B vaccine can help reduce the risk of liver cancer. But as far as a vaccine to treat cancer, they've had a long, very checkered history, and so far they have accomplished very little. There's actually one now that does work in prostate cancer, but it's taken 50 years to get one that actually worked in cancer. There's a whole bunch of reasons that vaccines do not work well against established cancers, unlike some other immunotherapy approaches, like what are called the immune checkpoint drugs, inhibitors that can work. But vaccines in general, as a prevention for cancer, are not likely to be useful for the next few decades because of some very real issues with how those would work. I mean, for example, there's just too many mutations that can cause a cancer, and you would need a vaccine against every one of those mutations, and so that's not going to be very practical. And vaccines to treat the cancer itself, again, you might get lucky and find one that worked against one particular kind of cancer, but vaccines there's a huge number of technical issues with them, but far more promise in some of the newer targeted therapies and immunotherapy approaches that are not likely to cure cancer, but can very substantially improve it and control it, and help prolong life expectancy and improve quality of life and reduce suffering.
Good, thank you. Louise, I know you've got some practical tips that you can give our viewers who are concerned about cancer and navigating the system. What would you tell them they should think about doing?
Yes, well, first of all, on an individual basis and for your loved ones, the first step for sure is to get as much information and support for all healthcare interactions that you can. I consider myself to be a fairly seasoned user of the healthcare system, and I would not go into the healthcare system to do anything alone these days. We really need supporters to help us and navigate the system. Second of all, please, if you do need to go to a hospital, don't delay. If you really need it, go. Take someone with you, as I've said, but don't get sicker, please. Reach out to any oncology patient group that you might be connected to, and certainly C.A.R.P for advice and support as required. Don't hesitate to ask questions about anything you don't understand, and make notes if you need to in order to go away and do some research on your own. I believe get vaccinated and get boosted. Dr. Stewart, if I'm wrong, I'm sure you'll let me know. But that's certainly my position. And I'm triply vaxxed. And if I need to be quadruply vaxxed, I'll do that too. And of course, you'll want to get as much information as you can about the rollout of these vaccines for younger people that are now becoming available, because your children and your grandchildren may be asking you questions about it too. So find out what you can. Of course, that's not that you shouldn't rely entirely on medical evidence, but get that evidence. And treat, I know this may sound obvious, but treat your healthcare providers the way you treat your family and your friends. They're suffering too, I can tell you. Sometimes they are not as accommodating as you might like, but believe me, they're going through some pretty rough times of their own. If you're dealing with a virtual care visit, I know that C.A.R.P has a C.A.R.P Fights Cancer article about this. And I can also tell you that Save Your Skin has developed a checklist to help you have a productive visit. So it's a list that says what to do to prepare for a virtual visit, what to do during a virtual visit, and how to follow up from a virtual visit. And that is on our website at Save Your Skin. So please feel free to use it. Now, I also have to say something about governments because we really need to get on our governments. At the federal level, I'm sure all of you know, but in case you don't, we have had Canada Health transfers flat at a 3% per year increase for more than a decade. So it's no wonder, as Dr. Stewart has quite properly said, that the healthcare system was not prepared for this pandemic and its impact on cancer patients and older adults was impossibly scandalous, really. So we had a broken system to start with. And these transfers, I would argue you should ask the federal government to proportion some of it dedicated specifically to cancer and older adults. Write to your MPs, write to the ministers of health, finance, innovation, mental health, seniors, Treasury Board, and tell them how you feel about that. And also write to the provinces and territories saying once you get these health transfer payments increases, ensure that you apportion part of it to cancer and older adults. And specifically in the province of Ontario, we have an election coming up next year. Demand that the government pay for take-home cancer drugs. We're one of the last provinces that doesn't do that, and we should. So if you get any chance to meet with any of these people, in addition to writing to them, take it. Canadians have to tell politicians and bureaucrats that they prioritize health and that they consider it as an economic investment, not a cost center. And perhaps you might want to remind them that our tax dollars pay their salaries.
Yeah, very, very well said, Louise, and certainly I agree. And C.A.R.P has continued to point out that people like you and I and Dr. Stewart can speak all we like on behalf of the Canadians across the country. But when individual voters tell the people they vote for, their representatives, their candidates, that they want this to happen, that's when they really listen. And we can educate you on the issues as we're doing today, but when it comes to getting change at the government level, you have to tell the people who represent you that you want that change, and then they'll really listen. Dr. Stewart, getting off our soapbox here and coming back to one last question before Anthony brings us the questions from some of our viewers. So what solutions would you suggest can be put in place by the healthcare system to optimize cancer care on a go-forward basis?
So that Louise brought up a very good point in Ontario for take-home medications to be paid for everyone, not just those over the age of 65. So it's interesting. If I've got a public servant, they'll have good insurance. I can get medications for them, but the person paying the taxes or paying for their insurance, they can't get those medications because if they're not covered by the government. But I also learned a hard lesson that back in the 2015 election, I told all the candidates I wanted to see a national pharmacare program. And I thought that'd be a good idea until I found out how they're going to do that through the Patent and Medicine Prices Review Board, where they were just going to cut the cost of everything. So they would have cheap medications we could get, but we could not be able to get any of the effective new medications. So that was their solution to that, so that we have to be careful what we ask for and make sure that they don't pull a fast one by then trying to make it look like they're doing what we ask them to do, but they're really not. But we do need a big investment in diagnostic technologies, PET scanners, CAT scanners. We need more specialists just so that people can get the biopsies that they need and can get the surgery that they need and can so that everything can move along. We need faster molecular testing so that right now, if I see a patient that needs molecular testing, it'll take 2 weeks before I get the answer. But some patients deteriorate far faster than that. And it's only because they don't have enough personnel working in the lab to get to move it through rapidly. So we need everybody to recognize that things have to happen faster. We've gotten too complacent that if we can make things happen in a certain amount of time, that's good enough. It's not good enough. We need everything has to happen very, very rapidly. We had talked about for lung cancer, like with metastatic non-small cell lung cancer, for every week that goes by, the patient is not started on chemotherapy, 4% of remaining patients die each and every week that they're waiting. So this is just the type of thing that we've got to change this to make everything happen much, much faster than what it is, and not be satisfied with the way that things have been in the past.
Good, thank you. I know we have a number of questions. Anthony, would you like to relay some of those for us?
Yeah, thanks very much, Bill. You guys can hear me okay?
Yes.
Mm-hmm.
So the first question was coming on something that Louise said about having support when you go to the hospital, but the viewers are reporting that they're not able to get in to support their loved ones when they're going to the hospital. Perhaps to Dr. Stewart, what would be your point of view from the point of the hospital in the need to have support when you're going for care versus protecting the environment from the spread of COVID?
Yeah, so early on, we were all very concerned about trying to keep to an absolute minimum, but we rapidly realized that was not a good idea. So if I had a deaf patient who could not hear me, I'd be sitting close to him to yell at him. He'd be yelling back at me, and there'd be a lot of droplets that were being exchanged, but little information. So that it was very important to have loved ones. And so we're trying to find ways around that. So as long as relatives are vaccinated, we're trying to make sure that at least one relative can come in with a patient. And also I encourage my patients to also bring their cell phones in and get the other people on the line as we're talking, so that we can try to get as many people in the conversation as we can. One of the things I tell all my patients, I tell them all that I only expect them to remember 10% of what I say the first time around, because it's a lot of new information, a lot of complex information, and they're of course very emotional about what's happened to them. And if with every relative that's there with them, will have heard a different 10% of it. So it's really very, very important that families be involved in it. But we've learned a lot about how to protect the system. We were concerned that if a lot of relatives came in and some of our nurses got sick, and then that closed down all our treatments and everything, we'd be in deep trouble. But we now know that if everybody's masked, if everybody's vaccinated, that we can loosen it up, and so that is very important. But even more important, the people that are admitted to hospital that cannot go home, just making sure that they can get their loved ones in to see them.
Thank you very much, Bill. A lot of the questions are about funding. I think a lot of the questions around the panel today are about funding. There's a question here. I'm not sure what province they're writing from, but they're asking if the federal transfer funds are actually fair for those who live in have-not provinces. Are Canadians getting equal care, especially cancer care, across Canada?
And of course, the answer is no. They're not. The transfers aren't fair, and there's a real inconsistency of the quality of healthcare in general right across the country. C.A.R.P has continued to say that your postal code should not determine your level of healthcare, and that's what's happening right now. So we are urging the federal government to put more funds forward, and in fact, perhaps not even worry about doing it within the Canada Healthcare Act, but a separate act to deal with these kinds of very major issues across the country. And what C.A.R.P has said to the federal government is, if you will start making this money available, our members will advocate in our own provinces to make sure that the provinces use them properly. And let's stop having this argument between the feds and the provinces of how the money is going to be spent. Seniors feel like the ping pong ball in this discussion, and that's got to stop.
Thanks. And maybe a question here that Louise might be best to answer about awareness and prevention. So we're talking about people who have perhaps delayed diagnosis, but prevention seems to be the most cost-effective way. What would you say from the point of view of the Save Your Skin Foundation about prevention?
Well, it seems that politicians seem to be elected for what they've allowed to get out of the barn, and the horses out of the barn, and they, and they can say, look, we got the horses back in the barn. And I would say that we do not spend anywhere near enough money on prevention and early screening. And we seem to spend all of our money after, again, everything is really far, far along the road. And it does, I'm sorry to be cynical. I'm not sorry to be cynical. Maybe I'm not, but, politicians never seem to run on platforms of what they prevented happening. They only run on what a great job they did in dealing with pandemics and other disasters that have befallen them and us during their term. And that's got to change. And until that does, and this is another chance for all the C.A.R.P members to tell everybody in the federal, provincial governments and bureaucrats, we want you to reallocate more dollars to prevention, and we will recognize you for doing that.
Thank you, Louise. Now, one thing I've noticed working in the offices of C.A.R.P is the fear amongst older adults of COVID, and that's what we're talking about in leading to reduced tests. We're looking at another media cycle of scary stories about a new variant. How do we prevent this from happening again over the next many months if there tends to be a new variant and new lockdowns? To anyone in the panel.
So I think we can expect new COVID variants, and we just have to remain aware. And again, social distancing, masks, and we just have to respond to the evidence. So the new one, Omicron, we have no idea yet whether it is going to be worse or not. But we have to be prepared for the fact that one can come along that's worse. And we just have to take all the things that we've learned and try to keep on making things move forward as rapidly as we can, with a little disruption as we can, based on what we have learned so far.
Bill, the media. Sorry, Louise, go ahead.
I would like to add to that, if I may. One thing that I notice is that people don't understand, a lot of people don't understand that by vaccinating third world countries, we're actually protecting ourselves. And so we try to shrink wrap borders and all of that sort of thing, which even Boris Johnson admitted isn't going to do us any good. And, he's not right all the time. And so, it's not just charity to vaccinate and give vaccines to everybody in the world who needs them. It's actually good for us right here in this country, because we've already seen whatever you do, these variants get here. But if these people were vaccinated, the chances for those variants, and Dr. Stewart, correct me if I'm wrong, the chances for those variants to mutate, for things to mutate and for us to have more different types of viruses certainly goes down.
Yeah, it does have to be a worldwide effort. It absolutely does have to be a worldwide effort.
Bill, we hear a lot of our members calling us and contacting us by by email, and they are very worried about the virus, rightfully so. But our advocacy has always been about being safe and protecting yourself, and we've never told people not to go ahead and see their doctor or consult with their doctor. So what's our message to members as they may be frightened of the virus, but their overall health is still important?
And that's keep doing what you're doing. Keep practicing the measures that we've all learned by now: hand washing, mask wearing, distancing, careful of where you are, getting vaccinated. As much vaccine is available to you when you can get it, and that will keep you as safe as possible. And don't over worry. The media reports every little thing that's happening. That means it's confusing. Talk to your own medical professional. Get the information from a medical professional you trust, who can understand what's being said, and don't treat COVID information like the stock market, which seems to go up and down every day. Remember, it is like the stock market in that we're in it for the long term. Plan for the long term. Follow the instructions and the things we know have worked to date, and you'll be best you can. And don't interrupt your other health care. Don't avoid the hospital. Don't avoid your doctor. Do what you have to do for yourself. It's a time that being selfish may be a better idea than in previous times.
Louise, we're talking to an audience of mostly older adults, C.A.R.P members, but this isn't an issue that's just affecting the 65 plus crowd or the 50 plus crowd. We've seen stories recently from McMaster University in Hamilton, Ontario, about pediatric cancer cases. So how do we have this conversation with our family and friends as well? It's not just about one demographic.
Oh, well, absolutely. We have to have those conversations. It's profoundly important. We want to protect everyone. Obviously, and Dr. Stewart, I hope will agree, we want to do it on an evidence-based way. So please get evidence-based information from your medical providers and others who have good information for you. Don't necessarily trust Dr. Google. I have yet to see Dr. Google's any of his or her medical certificates, and until I do, I'm a bit askance about that approach. So yes, you must have these conversations. We want to protect our families, and we want them to protect us. It's a two-way street, so we'll all be able to be together again. So I think those conversations must be had. What do you think, Dr. Stewart? Am I on track?
Yeah, no, I think you are. Very much so. Now the whole thing about the question about younger people, younger adults, we have to remember that cancer is much more common. The older you are, the more common it is. But it is the second leading cause of death in children and young adults. It is by far the leading cause of potential years of life lost in Canada, partly because of its impact on younger people as well. So that the good news is when a younger person gets sick, it's usually not cancer, but sometimes it is, and just seeking health care is important. But like with all of this, with everything we do, it's always there's rarely this demands that I do this demands that I not do it. It's always a continuum. Do I go to the emergency room now, or do I wait until morning to see if it's better? Or do I, what is the tipping point that takes me to, makes me actually do something? And if you're concerned about going to a physician or an emergency room, then it takes more to get people there. And that's where, so a number of the young people with cancer, again, the diagnosis is later than it should be. And one of the things that I point out to all my patients is that the cancer is very difficult to spot early on. So that the overwhelming majority of my patients, they're treated for something else first, before they found out that they've got cancer. It's only when they keep on getting worse over time and doesn't respond to the usual things that's what leads to the diagnosis. Well, I keep on telling them that we'd be much better off if cancer made people sick when it was very small and drew attention to itself, but it just does not do that. And when it does start producing symptoms, usually it looks just like something else instead. And so that's what takes the time. And so if it takes longer to get it investigated, then again, it's just further along. And the worse things are when it's first discovered, then the more difficult it is to deal with it. So early diagnosis is important, but sometimes it's a lot easier said than done.
Bill, we know how many lives cancer touches, and it's many more than the lives that COVID has touched thus far in Canada, thankfully. But as we're coming into a provincial election in Ontario, and politicians tend not to want to concentrate on issues, what is your advice to everyone listening, and how will C.A.R.P keep this topic on the top of minds of politicians as they are forming their platforms for the next election?
Well, this is an issue that's going to be a major part of C.A.R.P's advocacy platform in the coming months as we move to the Ontario election, but it'll also be high on the list for our members right across the country who are dealing in many cases with soon to come elections or newly elected governments who are beginning to make the decisions of what they're going to do during their term. And we're going to be supplying our members with information, background, suggestions of how they can work in their provinces and nationally to deal with this issue. And we're going to encourage them with the leadership of our excellent chapter leaders right across the country to make sure that every politician hears about C.A.R.P members' concern about cancer care in Canada.
Bill, we've just had another question come in about a specific instance where someone's loved one had passed away and they think the system had let them down. She's asking if sharing her story will help, or should she just join the crowd of people who are upset? Do the individual stories help to change the narrative?
Yeah, I'd be interested in Louise's response too. Mine is that absolutely yes. When people share their own story, when they're willing to do that, it's paid much more attention to than people like us with national organizations talk about the issue. So yes, please share your story. If it's directly involved with something Louise and the Save Your Skin Foundation is interested, get in touch with her. If it's a C.A.R.P issue, get in touch with Anthony or myself. Tell us the story and let us help you pass it on to others so people can hear from an individual who has personally experienced. And this is the kind of thing that often does hit home with our political leaders and our bureaucrats. And we need these kinds of real-time stories to make the point and make these people sit up and take notice.
Louise, yeah.
May I add? I absolutely agree. You know, people want to see real people and how they're impacted. One of the bones I have to pick with the media is that they often will tell an individual story, but then they don't go on to do an analysis of how that happened. In other words, this may be a systemic problem. This may not be just this one individual who's having this problem. This may be a whole host of individuals, and they're just one example. And often it's because there's something wrong with the way our system is running. And if we fix that part of the system, then that person and all the other people in that situation won't have that happen again. And that's the leap I often don't see. And that's what I would like to see. Tell the stories, and then let us as patient organizations help to describe what's wrong with the system that has caused that to happen.
I agree with that completely as well. Just as an example, there was a story in the Ottawa Citizen recently about a person who, after a long time trying, had finally managed to get a medication for cystic fibrosis. And this highlights the problem with access to drugs for rare conditions. They are going to be very, very expensive, but everybody facing it then has to go out and fight on their own to try to get access to these medications, unless they're a federal public servant, they've got the insurance that will cover it. But the people paying the taxes to pay for that insurance do not get access to those drugs easily. And we really need to fix the whole access to expensive new drugs. And not just anti-cancer drugs, but for a whole range of illnesses. You see, back when I was doing my training at the head of our department, a guy called MLJ Freireich, the most brilliant, most abrasive person I've ever met, we had Freireich's laws. And one of Freireich's laws was always be prepared for success. And we are not prepared for success. So in the cancer center, I now have patients coming back year after year doing fantastically well. They would have been dead within a few months just a very few years ago, but the treatments are working so much better, but they're also a lot more expensive. And this is something that we are not prepared for, is how to deal with this, to deal with this success. But that's really where we are right now. And part of the problem with an older population is older because so many different things are happening to let people get older, to have them older in good health, but then they get cancer. And so we just have to be prepared for that success and see what we can do to be prepared to solve this problem and deal with it.
Bill, I'm just looking at the clock. I'll turn it back over to you.
Yes, thank you very much. And I would say to anyone who is watching that has questions that they would still like to ask, please get in touch with us. Send an email to us at C.A.R.P. We will pass on the question to the appropriate people. And if you have suggestions for C.A.R.P. or the Save Your Skin Foundation or what Dr. Stewart is doing at the Ottawa Hospital, please give us those ideas too. We don't want this discussion to stop today. We want it to continue. We know the bottom line is we are each responsible for managing our own cancer care ultimately, and we want to give you the resources and tools so you're able to do that. I want to thank Dr. Stewart from the Ottawa Hospital and the University of Ottawa, and Louise Binder from the Save Your Skin Foundation for taking the time to be with us today to share your experiences and perspectives. This is such an important topic, and I'm glad we're able to share it with everyone. And I know that many more people will be watching this in the recording, which will be available on the C.A.R.P. Website and on the You Can Fight Cancer pages on our site. I also want to thank Merck Canada for helping support this webinar. And I want to leave you with what I think are two important takeaways. First, it's more important than ever for us to take control of our own health. This means being alert to the signs of cancer, to seek medical help without delay, despite the pandemic. And if it's cancer, the earlier the diagnosis and treatment start, as Dr. Stewart said, the better chances for a successful outcome. We also need to advocate for ourselves and our loved ones to ensure we get the best cancer care treatments. And second, we have to tell our politicians and our health leaders that we need to get our cancer system back on track even better than before the pandemic. We'll need more investment. We'll need be more creative. We'll need more efficient solutions to make this happen. A system that is making sure everybody can get what they want because it's at the lowest possible price isn't going to do it. We need more investment, and you should contact your elected members of parliament, your own provincial legislature, to ensure that cancer care is prioritized. In Ontario sooner, and then a little later in Quebec next year, there are going to be provincial elections. So ask your local candidates to make cancer care a top priority. If we work together, we can ensure that cancer care is available to everyone. Thank you all for watching and taking the time to listen today. We wish you a good day or afternoon, depending on what country you're listening from. And we welcome you to visit the C.A.R.P website to learn more about how you could be concerned about your cancer care. Thank you.